The sun is barely up. You are pouring your coffee. You line up the small stack of pills that manages your day. That little stack is critical. It keeps your blood pressure steady. It manages your cholesterol. It ensures your heart rhythm stays safe. That daily ritual, that crucial moment of self-care before 8 a.m., is essential for your health. But what if that morning routine contains a hidden threat? A risk not from your prescriptions, but from a common over-the-counter pill you keep in the bathroom cabinet. A pill you take without thinking, simply to address a headache or some joint pain. Every year, thousands of older adults end up in the emergency room because two drugs, meant to help, dangerously conflicted. They either amplified side effects to a lethal level, or worse, completely canceled out the life-saving medicine. This is not about forgetting a dose. This is about a deadly interaction between vital heart medications and very common OTC remedies. We are focused specifically on two categories of over-the-counter pills that are routinely mixed with critical heart prescriptions, often with devastating results for seniors 60 and older. Let us start with the first hidden danger, the common pain reliever. Maybe you woke up stiff, your arthritis is flaring. You reach for something strong to make the day bearable. You trust these pills because they have been available without a prescription for decades. This is where the first critical danger lies, especially if you are taking medication to manage blood pressure or to prevent clots. We are talking about NSAIDs, non-steroidal anti-inflammatory drugs. You know them best by their commercial names, Ibuprofen, like Advil or Motrin, and Naproxen, like Aleve. These are excellent pain relievers, but they hide two extremely serious risks for your heart health. First, the bleeding risk. If you are on a blood thinner, medications like warfarin, Eliquis, or Xarelto, reaching for an NSAID is incredibly risky. Blood thinners already reduce your body's ability to clot. NSAIDs, particularly when taken daily, also thin the blood and significantly irritate the lining of your stomach and intestines. Combining these two means you drastically multiply your risk of a severe bleeding event. This internal bleeding can happen silently, without warning, and quickly become a medical emergency. You may just feel increasingly weak or dizzy. This is why doctors emphasize avoiding regular NSAID use if you are on any blood thinner. But the danger does not stop there. NSAIDs pose another hidden threat if you take medication for high blood pressure. If you are taking blood pressure pills such as diuretics, ACE inhibitors, or ARBs, you need to listen closely. NSAIDs can actually cause your body to retain salt and water. Think about what your blood pressure medicine is trying to do. It's trying to reduce fluid volume and relax your vessels to lower pressure. When you take an NSAID for a week or two, that fluid retention works directly against your blood pressure medication. It slowly pushes your blood pressure up, sometimes dangerously high. You are diligently taking your prescription every morning at 8 a.m., but the common pain pill you took at 10 a.m. is slowly canceling out its effects. It undermines the very foundation of your heart stability. It's an invisible sabotage of your health routine. So what should you do instead? If you need regular pain relief and you are on blood thinners or high blood pressure medication, you must talk to your doctor or pharmacist about acetaminophen, commonly known as Tylenol. Acetaminophen manages pain without the severe stomach and heart risks associated with NSAIDs. But remember, acetaminophen requires careful dosing, especially if you have liver issues, so always confirm the right dosage with a medical professional. Now, we move to the second major category of OTC medication that seniors often take immediately after breakfast, one that poses an entirely different but equally serious threat to your heart rhythm and blood pressure stability. This second dangerous OTC is often found tucked away in the cold and flu aisle. We will start detailing the risks associated with these cold remedies and what specific ingredients you need to check for before you ever buy them in the next part of this guide. We have started our crucial morning safety routine. If you missed part 1, please go back and watch it now. You know the ache. That stiff knee, the throbbing headache, or the sudden back spasm. Your instinct is to grab a common pain pill. That little white or blue tablet is often the biggest danger hiding in your medicine cabinet. We are talking about NSAIDs. This stands for non-steroidal anti-inflammatory drugs. The most common ones are ibuprofen and naproxen. You probably know them as Advil, Motrin, or Aleve. If you are currently taking medicine for high blood pressure, managing heart failure, or dealing with kidney issues, these over-the-counter helpers are potential enemies. NSAIDs interfere with almost every major heart medication. First, they can significantly raise your blood pressure. They cause your body to retain salt and water. This is exactly what your blood pressure medicine is trying to prevent. Taking an NSAID is like working against your prescription. It actively defeats the purpose of your daily medication regimen. If you take an ACE inhibitor, like lisinopril, or an ARB, like losartan, these interactions can be very serious. They can raise your BP back up, undoing weeks of careful management. Second, they are lethal to diuretics. If your doctor gave you a water pill or diuretic, hydrochlorothiazide, furosemide, or others, mixing it with ibuprofen is like erasing its effect. NSAIDs hold on to fluid. Diuretics push fluid out. When you mix them, the fluid builds up. That extra fluid strain severely hurts your heart. It is the #1 reason many people experience worsening heart failure symptoms without knowing why. This is combination danger #1. The solution is simple but requires morning vigilance. Check the active ingredient label on every pain pill you own. If it says ibuprofen or naproxen and you have heart problems, you must call your pharmacist today. For most people, the safer alternative for occasional pain is acetaminophen, commonly known as Tylenol. But even acetaminophen must be taken strictly at the recommended dose. Now, let's move to combination danger #2. This danger hides in the cold and flu aisle. You get the sniffles. You feel that terrible head, congestion, and pressure. You want relief right away. You grab a pill labeled maximum strength sinus relief. If you have a heart condition, especially high blood pressure or a history of arrhythmia, you must check the active ingredients of cold medicine immediately. We are looking for decongestants, specifically pseudoephedrine or phenylephrine. These ingredients are designed to constrict blood vessels. They shrink the blood vessels in your nose to clear the congestion and make breathing easier. This feels like relief, but the effect does not stop at your sinuses. These substances constrict blood vessels throughout your entire body. What happens when your body's vessels get tighter? Your heart has to pump blood harder and faster to force it through the restricted pathways. This dramatically spikes your blood pressure. For people already managing hypertension, this spike is genuinely dangerous. This is why doctors forbid them. A sudden, sharp BP increase can trigger an abnormal rapid heartbeat called tachycardia. It can even lead to more serious cardiac events. If you see a cold medicine with a D on the end, like Allegra D, Mucinex D, or Claritin D, that D almost always means decongestant. That D is a serious warning sign for your heart. Never assume a cold medicine is safe just because you bought it on the shelf. The only difference between these common decongestants and prescription cardiac drugs is the dosage and context. They are potent chemicals. Before 8 a.m., when you organize your prescription pills, you need to conduct a physical inventory of your risky OTCs. Move the bottle of ibuprofen out of easy reach. Transfer the sinus medicine out of your bathroom cabinet. Place them where you cannot grab them without consciously thinking. What can you use instead for a bad cold? Focus on saline sprays, plain cough suppressants, or plain expectorants that do not contain the D ingredient. Steam and rest are often the safest prescriptions. The goal of this morning check is vigilance. It is about empowering you to take control of what goes into your body, making sure those 2 essential OTC pills are never mixed with your vital heart medication. We have covered the 2 most dangerous over-the-counter pharmaceuticals, NSAIDs and decongestants. But our morning medication check isn't over yet. We still need to talk about those healthy additions, those natural vitamins and supplements you take to boost your well-being. Many supplements seem harmless, but they can be just as potent as prescription drugs when mixed incorrectly. In Part 3, we reveal which 3 common supplements can make your blood thinners completely useless, putting you at high risk. Stay with us. We just finished discussing how common decongestants can dangerously elevate your blood pressure. Now, let's move immediately to the second major medication trap lurking in your cabinet: This trap involves pain. Many of us are dealing with arthritis, knee pain, or chronic backaches that flare up unpredictably. What do we automatically reach for? Ibuprofen, Advil, Aleve, Naproxen. These are non-steroidal anti-inflammatory drugs, or NSAIDs. They are readily available and seem completely harmless because they don't require a prescription. But if you take certain heart or blood pressure medications, they are incredibly disruptive. If you are managing hypertension, heart failure, or have kidney issues related to your heart health, you must proceed with extreme caution around NSAIDs. Here is the exact mechanism of danger. Your prescription heart medications, especially diuretics, water pills, and blood pressure reducers like ACE inhibitors or ARBs, work hard to help your body manage fluid and sodium. They allow your kidneys to efficiently filter out excess water. NSAIDs interfere directly with this critical kidney function. They act like a block on the filtration system. They cause your body to hold on to salt and water that your diuretics were trying to flush out. This is the opposite of what your heart prescription is trying to accomplish. If you take a daily dose of Naproxen for your painful knees, you are essentially asking your heart medication to fight a losing battle every single day. Over time, this interference reduces the effectiveness of your blood pressure pills. It can lead to increased swelling in your legs and ankles. It places enormous strain on your heart and can cause sudden, dangerous spikes in blood pressure. If you notice your blood pressure readings creeping up, or if your ankles look puffier than normal, even though you haven't missed a single dose of your prescription, the hidden culprit might be the ibuprofen you took for that lingering headache. This risk is not exclusive to chronic use. Even starting a short course of NSAIDs after a minor surgery or dental work can be enough to significantly destabilize a fragile heart condition. You must communicate this OTC choice to your cardiologist or primary care physician immediately. So if ibuprofen and naproxen are off limits for pain management, what is the safer option for those of us focused on heart safety? For most heart patients, the safer alternative for pain and fever is acetaminophen, commonly known by the brand name Tylenol. However, even with this safer choice, we must be incredibly disciplined about dosage. Do not exceed 3,000 milligrams of acetaminophen in a 24-hour period, and consult your doctor for your specific safe limit if you have any history of liver issues. This brings us back to the vital importance of reading every single label before 8 a.m. Remember, many multi-symptom cold and flu relief products, even if they aren't labeled as a pain reliever, often contain a large dose of acetaminophen already mixed in. If you take one of those for a daytime cold and then take a dedicated acetaminophen pill for a headache later, you are now dangerously close to an overdose limit. It happens much faster than you realize. These two over-the-counter pill types, decongestants and NSAIDs, pose the greatest daily threat to the efficacy of your vital heart and blood pressure prescriptions. They are common, they are cheap, and they are hiding in plain sight. Medication safety is not about living in constant anxiety. It is about knowledge. It is about replacing dangerous habits with safe, informed alternatives. It's about knowing the exact right pill for the exact right ache. We have addressed the two primary dangers found in the pharmacy aisles, but the checklist isn't complete yet. In our final segment, we are going to look at the hidden risks that come from health supplements that promise great results. These often interact silently and violently with your blood thinners. We also need to talk about timing, how taking the right pill at the wrong time of day can be just as dangerous as taking the wrong pill entirely. We've established the two critical dangers, certain common pain relievers and certain sinus medications. But we need to look closer. The real danger often hides in plain sight, disguised as something harmless. These ingredients rarely travel alone. They are the active components in countless combination medications. You think you are taking a simple, multi-symptom cold pill. You believe it is just one drug. But that pill contains 3, sometimes 4, active ingredients working at once. One ingredient fights the fever, another dries up your nose. It is that third ingredient, the decongestant, that attacks your heart pressure. You must become a detective about combination medications. Think about the pills marked PM or nighttime. These are incredibly popular for seniors who struggle with sleep. They often add an ingredient like diphenhydramine. While this helps you fall asleep, it is also an anticholinergic drug. Anticholinergics can interfere with how your heart rhythms stay steady. They can increase your heart rate. They can also make you confused or dizzy, especially when combined with your morning blood pressure medicine. So the safety rule is simple. If the box promises to solve more than 2 symptoms, approach it with extreme caution. This brings us to the core action item for your before 8 a.m. medication safety checklist. This is the ultimate preventive habit. Before you swallow anything new, or even something you think you know, hold the box up to the light. Find the specific box labeled active ingredients. Do not look at the marketing claims on the front. Look only at the list of chemicals. Scan that list for 3 key words. If you are on blood thinners, you are looking for ibuprofen and naproxen. If you are on blood pressure medicine, especially ACE inhibitors or beta blockers, you are looking for pseudoephedrine and phenylephrine. If you see one and you take vital heart or stroke prevention medicine, stop. Do not assume you remember the last time you checked. Put the box down. What if you have a massive headache right now? What if your joints are aching fiercely after a cool night? You need relief without risking your heart. The first and safest route for most seniors on heart medication is acetaminophen. This is the main ingredient in Tylenol. Acetaminophen rarely interacts negatively with your common heart medications or blood pressure stabilizers. It is metabolized differently than NSAIDs. However, there is a limit. You must always check the dose and ensure you do not exceed 3,000 milligrams in 24 hours. Too much can damage the liver. What about congestion? If you are stuffed up and trying to avoid those powerful high-risk decongestants, focus on local, topical relief. Use simple saline nasal sprays. They use salt water to loosen mucus. They work directly on your nose without traveling through your bloodstream. They cannot raise your blood pressure. For pain, simple heat pads or ice packs often handle localized joint discomfort better than internal pills. Physical therapy, exercises, and stretching are safer long-term strategies than daily use of potentially risky OTC drugs. Your 8 a.m. safety checklist is not just about avoiding problems, it's about finding sustainable, safer solutions. Never guess. This is the golden rule. If you are unsure, if a label uses confusing language, or if you can't tell what kind of pain reliever your prescription doctor just recommended, always confirm. Your pharmacist is your best safety net. They see dozens of interactions every day. If you grab an OTC item at the pharmacy aisle, do not pay for it yet. Show it to the pharmacist. Ask simply, "I take name your heart medicine. Is this safe?" This quick check takes 30 seconds of their time. That 30 seconds can save you a frightening trip to the emergency room, or worse. If your doctor or a specialist prescribes a new pill for any condition, be it a skin infection or a bladder issue, immediately list every single OTC item you take. Tell them about your nightly sleep aid. Mention the aspirin you take just in case. Include the vitamin D and the herbal supplement you started last week. We must remember that many vitamins, especially high doses of vitamin K, can impact blood thinners. We will cover supplements in a future segment. The key to your before 8 a.m. medication ritual is control. It is about knowledge. It's about knowing exactly what is entering your body alongside those critical, life-saving heart pills. We started the day checking our pulse and measuring our blood pressure. We finished the morning routine by confirming the safety of every over-the-counter drug in our cabinet. This diligence pays off. This is how seniors manage their health effectively and safely, one morning at a time. Next time, we turn our attention to another core pillar of senior health that is often overlooked and surprisingly dangerous when ignored: hydration. We will discuss why thirst isn't always the first sign that seniors need water and what simple drinks you should avoid before lunch.